All right, so welcome to this Facebook Live session on the Health Data Science program at Harvard University. I'm JP Onella, and I'm the program director.
And I'm Heather Maddie, and I am the executive director.
We're going to take about the first 15 minutes or so to talk about the program first, and then we'll open up for questions. You can leave your questions in the comment section of the live event on our page. So, what is the Masters of Science in Health Data Science program? So, first of all, I wanted to introduce the executive committee of the program. In addition to Heather and myself, we have 4 faculty members on the executive committee. The executive committee is responsible for things like student supervision, teaching core courses in the program, and advising students on the core project, on the capstone project. So in addition to the 2 of us, the faculty consists of Drs. Brent Kuhl, Jeff Miller, Christoph Lang, and Christine Jorat. I think that's how you pronounce her name. So what is data science? So data science is really an interdisciplinary or multidisciplinary field, and it's in the intersection of statistics and computing. It deals with inference, data wrangling, development of algorithms, and data visualization. And there are more than one definitions for data science, but the following quote is quite apt to capture the relevance of data science for today. And this is from the chief economist at Google. The ability to take data, to be able to understand it, to process it, to extract value from it, to visualize it, to communicate it, is going to be a hugely important skill in the next decades, not only at the professional level, but even at the educational level for elementary school kids, for high school kids, for college kids. Because now we really do have essentially free and ubiquitous data. And the core of our program is that although we do have all these data now, what's really essential is to be able to have the necessary skills for making sense of the data. And that really is the foundation of our program. So what is a data scientist? And just like for data science, we have multiple definitions. We also have multiple definitions for what it means to be a data scientist. The following is the definition given by Dr. DJ Patil, who used to be the White House chief data scientist. According to DJ Patil, a data scientist is that unique blend of skills that can both unlock the insights of data and tell a fantastic story via the data. Again, this is just one of the several definitions that exist for a data scientist, but I think we can all agree that it's a blend of multiple skills from several disciplines. If we think about health data science, what do we mean by health data science more specifically? So health data science is data science for health data, which refers to any data that pertains to the biomedical sciences and public health. So the data might originate from observational studies, clinical trials, computational biology, electronic medical records, healthcare data claims like Medicare. It might be genetic and genomic data. It might be digital phenotyping data, and so on. So there are lots of fields that produce the kind of data that's of relevance to health data science. The health data science program that we have is brand new, and our first cohort has just started 2 months ago. The program is a 1.5-year-long program, meaning that it consists of 3 semesters. The program also includes what's called a capstone course, and it doesn't have a traditional thesis. The students will receive training in multiple areas, including quantitative methods, applied regression analysis, statistical inference, statistical computing, machine learning, statistical consultation and collaboration, and epidemiology. And with that, I hand it over to Heather.
All right, so let's get a little bit more in detail about what we actually mean about the 3 semesters and what you can expect to take in terms of curriculum and courses. So the first semester, you'll have 3 core courses, and our first semester always begins in the fall. So you'll be here for 2 fall semesters and 1 spring semester. You'll take an epidemiology course as well, and then 1 to 2 electives. For your second semester, you'll still have 2 core courses to complete, along with a computer science course that is a requirement, and 2 to 3 electives. And then finally, in your third semester, you'll finish up with your capstone course and any other additional electives to make up the 60 total credits for the 3 semesters. The application cycle that begins now and is running right now and due in December, that program will start August of 2018, so next year, and students will finish courses in December of 2019, and then the degree will be conferred in March of 2020. You can apply for summer 2019 internships while you are a student in the program, and because students finish coursework before the degree is actually conferred, you can seek full-time positions beginning in the January after the coursework is concluded. And so we have developed 4 brand new courses specifically for this program, and while the Health Data Science Master's Program students take these as their core courses, it is open to the other school students as well. And so we have an Introduction to Data Science and a Data Science 2 series. We have Computing for Big Data and Applied Machine Learning. And these really provide the foundation that you need for all the data science skills that you'll apply in the workforce. We have a really broad range of possible elective courses that you can take in computer science, public health, statistics, informatics, and network science. And I think that really sets our program above and makes it different than other programs, is the flexibility that you have with the electives that you can choose. All right, to get to some actual core curriculum, and also curriculum from the computer science requirement course and also the other electives. So for the core courses, you'll be learning all of the needed skills to actually do data science. So that includes statistical inference, data wrangling, for example, visualization, machine learning, as well as computing for big data, all the way to epidemiology methodology, which sets our health data science program apart from a typical data science program. For your computer science requirement and your electives, again, it's very broad, but you can really focus on more computer science courses that involve software engineering or data systems, and you could also focus on more biostatistics electives such as applied survival analysis and applied longitudinal analysis. And as JP said before, we do have a capstone course in place of a traditional thesis, so it's not actually a thesis. Students will spend a full semester working on 4 different projects. 2 of them will be individual, and then 2 of them will be in a group. So you'll get both individual and collaborative project experience. And it's equal to 7.5 credits, which comes out to about a 1.5 semester courses. So it's worth more than just 1 full-length semester course. So it'll be fairly intensive, and you'll apply all of the skills that you learned in your core courses and electives to specific projects that evolve around research and include health data. The main programming languages that are used in the core courses include a mixture of Python and R. Many of the electives also use Python and R, as well as SAS, and a lot of the computer science electives include C++, Unix, Java, and many other computing languages. To give a little background on the current cohort, again, this is our very first cohort. They just began their coursework in August of this year. They will complete their coursework in December of next year. We have 16 students in this cohort, 10 women and 6 men, and there are 9 international students. Just to give a little bit of background, some of them came directly from undergraduate, Some came from the workforce. They worked as project managers or data scientists or in the public health field in consulting. And 2 of them came from another master's or doctoral program. They do have very diverse degree backgrounds. They are in the STEM fields, however, because that is a requirement for application eligibility and program eligibility. So math and statistics are highly popular among our cohort backgrounds, but we also have people from chemical engineering and finance. So it really does have a broad range. And they also did work in various areas, such as marketing and pharmaceutical consulting, all the way to nonprofits as well. Okay, and then just some application details. So to be eligible for this program, you do need a prior degree, an undergraduate degree in a STEM field. You do need to have knowledge of computer scripting and programming. Knowing R or Python would be the best languages to know and to prepare for this program. But if you've been exposed to C++ or some other computing language, that's also good. Multivariable calculus, and you need at least 1 semester of linear or matrix algebra, and excellent written and spoken English skills. So that is just the eligibility requirements. For the actual application, which will go through the system called SOFAS, we need your GRE or MCAT scores or your TOEFL scores if that applies to you. We also need your transcripts or mark sheets, a statement of purpose, letters of recommendation, and your CV or resume. And just remember that the deadline is December 1st, so you have 10 more days to get your application in.
And always remember to check the actual requirements from the program webpage, so for the latest up-to-date information. Thank you, Heather. I think that's probably all we wanted to. I think we're essentially perfectly on time. So hopefully this will have given you some kind of an overview or background of the program, and we can then see if there are any questions that people have. Do you want to start with one, or
Sure. So we have a question about how many applications we receive for the degree in health data science. I would say it's around 100 or so. It's going to change year to year. We hope our program gets more popular and gets more applications as we go through more years, but I would ballpark it around 100.
That's great, thank you. There's another question about what is the intake for this course, and that also will depend a little bit on different factors, but we would anticipate that to be perhaps around 15 or so students. That was an easy one, I got the easy question.
Yeah. Some of these questions are quite long, so give us just a second to read some of them.
So there's one question which is about work experience. Work experience is required, and I don't think that's a requirement. I mean, some of our current students do have work experience, but some of them just came directly also from the undergrad. So again, it's a mixture. There are probably some benefits to having work experience, but it's certainly not a requirement. So you should feel free to apply even if you don't have any work experience.
One question is, do we have the curriculum available online? So yes, under the on the Health Data Science webpage, there is a program tab, and we list links to all of the courses, the core courses and the electives and the computer science requirement courses. We provide links to their course descriptions. So hopefully that'll help you get a sense of what topics are covered in different courses for the degree.
And I believe if you click on those course links, you'll be able to see a brief description of the course content, not the course details or the materials, but you'll get at least a few sentences of a description. And all of those links should be active on the HDS webpage.
You also get to know, it'll tell you if it'll be a fall or a spring course, in case that helps at all.
There's one question. If I finished my undergraduate degree in the United States, do I need to submit TOEFL score? And I believe, again, check the webpage for the final word on this, but I believe if English is not your first language, you do. Is that correct?
That's correct. Yeah.
All right.
Yeah, and I would still double check with the registrar, especially. The registrar will know all of the application details, especially with test scores and submitting transcripts.
Lots of great questions here.
So I like this question. They saw the prerequisite for the program involves 1 semester of linear algebra and multivariable calculus, and they will be taking them next semester. Besides that, are they still able to apply? And yes, you will still be able to apply as long as you indicate that you are taking those courses. And somewhere on the application it says that. This actually is very common. People will finish up, or students will finish their requirements maybe from an undergraduate degree before, or I should say after the application has been submitted. And what will happen is if you are admitted to the program, we will request an official transcript once you have completed the needed courses.
That's right. So there are a couple of questions about their average TOEFL or GRE scores or grades for past students that are admitted, and it's one thing. First, is what's important to understand is that the executive committee jointly makes decisions about admissions, and so we typically cannot comment on specific past scores, but our students tend to be, they tend to have very competitive backgrounds, so students generally have done very well. So that's probably as specific as we can be. We will consider your entire application, so it's not just a case that we look at a single number. Everything that's included in your application we will consider and review very carefully. And again, decisions are made based on the entirety of that information that you provide, and it's going to be reviewed jointly by the entire committee. So I wouldn't look at a single criterion. I would look at the strength of the entire application package. I think that's hopefully helpful.
There's one about the cost of the degree. The School of Public Health actually has an outline of tuition fees on their website, and we do have 1 or 2 possible scholarships for students, but they are very, very competitive. So if you would like to see exactly how much tuition will be for next year and throughout the degree, visit the T.H. Chan School of Public Health website.
And there's one question about will there be a PhD program for this in the future? And that's a great question. So, at this point, I guess the answer is still up in the air. However, one thing that we can say is that some of our current students are considering applying for a different PhD program. So, for example, some of them are considering doing a PhD in the biostatistics department, perhaps in ours. Some might pursue a doctorate in computer science and so on. I don't think there are currently any PhD programs in data science, but I could be wrong on that. These things keep changing all the time. But we currently don't provide a PhD in data science, and we'll probably not do that in the near future. But the idea is that this master's program could be a great foundation if you wanted to pursue a PhD in a related field.
There's a good question about any internship or work component to the degree, or if it is just the coursework and capstone course. For your coursework during the degree, there are no internships or work components built into the degree itself. You are free to look for internships, and we can definitely guide you to internship possibilities while you are a student here. We have a fantastic career career office downstairs that works with students all the time to find them internships and jobs and work on their resumes and things like that. So while we don't have one set up for students who enter, we can definitely help you find one during the degree.
That's right. Let's see what else we have here. So here is another question about, this is related to the point you made, the question you addressed earlier, Heather. If somebody's applying outside of the US and the verification of their transcript might take some time. So the question is, will it impact their application if the verification can only be finished after the submission deadline?
It won't. I believe if you can get the official submission turned in before February, I think that is fine. As long as you have your SOFA's application turned in by the deadline, you should be fine.
And it's a very important question. So one thing we will do is we will add this on the FAQ of the HTS program, and we will then also add the formatted answer there. So then you can be sure about that. There's one question about the possibility of taking health economics electives. Is this something you can comment on?
Yeah. So it is possible to take electives at other Harvard schools or MIT while you are a student. You have to get approval from the executive committee to make sure the course is substantial enough to count towards your degree. But we have the current cohort of students have taken classes at the business school as well as MIT. So it's definitely possible to get an elective in health economics.
And that really is kind of one aspect of this whole program. And we've tried to make this fairly flexible because we realize that data science really is like an umbrella for a lot of things, a lot of academic fields and disciplines. So you do have flexibility as long as the executive committee or the executive director, who sits right here, approves your choices. The goal is to make sure that you get the best possible education, but we also make sure that the degree forms a more or less coherent whole.
Okay, this is a good one too. When would the decision be communicated, and will there be interviews? So there will not be interviews. We don't interview for master's programs. The decisions will be made around February, I believe. I can't give you an actual date of when acceptance emails or letters will be sent out, but we do review all of the applications in December and January, so there should be decisions made by mid-February at the latest.
One of the questions here is about how to gain research experience in the program. And you will gain some research experience throughout the whole program, but in particular, you will gain research experience in your last semester, which is the fall semester in the capstone project, which is again 7.5 credits. And the idea is to take everything that you've learned as during your time here at Harvard, and then you get to apply that. And it's very much a research-driven course. The idea is you will have individual projects and you will also have group projects, and that's really your time to take everything you've learned and put into practice. Also during the summer internship, you may have a good opportunity to do research, and it may also be possible to find opportunities here at the various research groups that we have here at the school. So I think you will get a lot of experience actually doing research and applying these skills. And this is one of the reasons why we didn't want to introduce a master's thesis to this program. And many programs do have a master's thesis, but we really wanted to make sure that you get to learn and apply those skills in the way that you might actually be then applying them in your future, wherever your future may take you. So one of the questions here, maybe I'll address this since it's closely correlated with what I just said. So the question is, can you do a thesis for a capstone project? And no, so we don't have a thesis in this program. So the capstone project really replaces the traditional thesis.
So there's a question about how many letters of recommendation you need for the application. I believe you'd have to check online through the SOFIS system, but I believe it's 3, and I think you can have a maximum of 4. But we require 3. And I would definitely make sure that the letters of recommendation are from people who know about your communication skills and your quantitative skills, most importantly, and then we'll also give you a very strong letter.
So one question, the person is saying that they're applying before they finish the undergrad degree, and can they apply as long as they finish their undergrad degree by the time the data science program starts? And I believe the same applies to that, what was just said about completing the prerequisites for the program.
Correct, yeah. Do we require a WES evaluation of our GPA if you're from a foreign country? And the answer is yes. I don't think SOFIS actually tells you directly that you need that, but you do need that. So do get the WES evaluation.
So we have a few more minutes, so feel free to ask your questions. Let's see what else. So there's one person is asking about career opportunities when you have a master's degree in health data science versus a master's degree in biostatistics. And we actually, in this department, we have 2 master's degrees in biostatistics, and then we have a degree in computational biology and quantitative genomics, and then we have a 4th master's in health data science. And if you compare the HDS master's degree to a more traditional biostatistics degree, the biostatistics degree is really meant for people who follow the more traditional biostatistical career trajectory. So they might end up working for the government or in the industry, in the pharmaceutical industry, and so on. They might be charged with running clinical trials and so on. Whereas the HDS program is really broader. So we anticipate that our students will continue along different trajectories. Some will probably go to industry. And I believe that some of our students might even end up in places that are traditionally not health related. So, for example, companies like Apple and Google are increasingly interested in health and well-being. So I wouldn't be surprised if many of our students ended up in those types of places, which would be a little bit less common for people with a standard biostatistics background. One reason why it's difficult to give very precise trajectories is because we have so much flexibility with the degree. So it really depends on how you choose to weigh your degree. So for example, you could have an HDS master's degree, which is pretty heavy in things like, say, machine learning. And then you would probably have a somewhat different career trajectory than somebody who focuses on epidemiology and perhaps clinical trials and so on.
And just to touch on the flexibility thing too, because of the wide range of elective courses that you can choose from, you can really tailor the degree to focus on what you are really interested in and what career trajectory you want to take. So that could be more computer science or biostatistics or informatics and medicine.
All right, we have lots of questions coming now that we're running out of time. Let's see. Do you have any take on these couple of questions here?
So there's a couple of people asking about recommendation letters coming in after the deadline. That is not allowed. Well, I mean, it's allowed, but if you cannot get your letters in by the deadline, we will not review your application, unfortunately.
There's one question, is it possible to finish in 2 semesters? So the answer is no. This really is a 1.5 year long program. There are some master's degrees out there that are specifically for 1 year, and there are some master's programs that are for 2 years. Ours is between the two, so it's for 1.5 years. So it will not be possible to finish this program in 2 semesters. One question is, do students need to have a concentration within the degree? So we don't have a concentration within the program, so you can tailor this degree to be whatever suits your interests. So there's no concentration. Do you want to take maybe one or two more questions?
Yeah, I'm trying to think about, so there's one if we have an Indigenous health focus or faculty involved in Indigenous health at the master's level. I can't think of anybody in the biostatistics department. I can think of faculty in the social behavioral sciences department. I can't give you any specific names because none are coming to mind right now, but I do know that that department does some of that research. So I'm not sure. I don't think there's anybody in this department though.
I think you're right. There is one question about essentially about our experiences so far with the cohort and what makes this program stand out. So I think one of the unique aspects of this program is that we are located on Harvard's Longwood campus, so we're surrounded by hospitals, and we really try to offer a combination of data science in the setting of health and biomedical sciences more broadly. So that's one thing that makes this unique. So this is not your standard data science program that might be based in, for example, a computer science department. Our experiences, so Heather and I, we both teach courses in this as part of this program, which are also open to more broadly to our students. And so far, I think we've got some very good feedback from the students. I can only speak for the students I interact with and are taking my classes, but people really do seem to enjoy the program a lot. And usually when you start a new program, there may be complications, but I think we're off to a very good start in this program. We have a very dedicated faculty, and we have spent years planning this, so I hope that's one of the contributors to why things are going well. Is that your experience when you interact with the students?
Yeah, it's definitely my experience. I'm teaching one of the core courses right now, and I interact with the students quite a bit, the entire cohort of 16 students. And the feedback seems to be, for the most part, very, very positive. Anything that we can improve, we act on fairly quickly. So I think they're all very satisfied with how it's going right now, and they're really excited for their spring curriculum and looking for summer internships.
And one thing I might add to this is that, again, we've added, I think, 4 or 5 courses for this, specifically for this program, such as data science to introduction to machine learning and so on. So I think that's one of the reasons why we've gotten to, I think, a very successful start of the program. So we're getting, I think, to the end of our time. We have scheduled about half an hour, and there are lots of questions here that we didn't have a chance to address. But what we'll try to do is we'll take note of your questions, the ones that you have asked, and the ones that we're not able to address during this half an hour or so. And we'll be adding those questions. We may reformat them slightly, and then we'll provide answers to those questions on the FAQ page of the program. So thank you so much for joining us, and we hope that you will apply the program, and we'll hope that you'll get in, and we'll hope to have the opportunity and privilege to meet you in person. So thank you everyone so much.
Thanks for tuning in.
Bye-bye.